All right. So we are in Dr. Armando Ingegneri's studio with Mr. Paolo Capizzi, who's Lieutenant Colonel of the Italian Air Force, who came to see Armando Ingegnieri because of a problem that he was having due to stress that he had from work situations and other things of that nature. And this stress had expressed itself in behavior and physical problems that in fact were panic attacks, but which he will now tell us what they seemed like to him.
Yes, good morning to everybody. Yes, I had some symptoms about after I discovered there was a panic attack, but the first glance it seems to me that was a heart attack, because
a heart attack.
Heart attack, because I suffer a very stressful period from input coming from my family, mother family, and of course from the job and from normal life. And in one day I was out for a conference. I was one of the speaker, and suddenly I felt something like a heart attack. I never had any physical problem before.
Mm-hmm. What was it like? Was it? Did you feel pain in your chest?
Yes, it's you can't breathe properly, and your blood pressure goes up suddenly, and you feel your heart pumping very fast. And
so quite frightening.
Yes, because to me it seems there was a heart attack.
I see. Yes, of course.
I never suffered about that. Just I've heard about it.
You'd heard about it, yeah.
But I never had some experience. So I was some people that was there bring me to the hospital. I had all my medical check. I was okay, just a little bit high pressure. And after that day, I had the day after, also other days, in the next days, next months, similar effects. Also in England, when I was there for a conference, always for a conference, and I spent 3 or 4 days I was there in the hospital, or some doctors come to the hotel, because the symptoms was always the same.
So you always had this kind of this pain in your heart with this pumping heart.
Yes.
And this difficulty in breathing and high blood pressure.
Minimum was about 100, 120, and the maximum 200.
Gosh.
Yes, was something like that. Also because when you feel this kind of symptoms, you also it's like the cat that take his tails.
Yeah, exactly.
You don't know how it starts and how it's finished.
Of course.
It's a consequence.
You don't know.
So
which
you
comes
increase
first.
your tension.
Of course. That makes it worse, of course.
And until a doctor told me that in England that was a panic attack. I never heard that, but
that was your
I always
first
thought
time.
that could happen to everybody, but not to me.
Also, you would have reason to say that because you'd had training also of a specific kind. You were able to. You'd been trained even to be in situations that require calm and control.
I was also. I had experience twice in Antarctica, so I spent in a particular place 3 and 4 months.
Gosh.
So I hadn't any problem before.
You had tested yourself quite well.
Yes. And I said, panic attack. And now, unfortunately, I had a friend that introduced to me his friends. It was Armando Ingegnieri. I went to him to speak about my problem, and it was a new approach of the psychologist that normally psychology use for treat this case. And I always be a little bit, I would say,
skeptical.
skeptical. Yes, that's the right word. Skeptical, and
you mean about psychologists
in general? Yes, and he's told me about his new method to treat this case.
The psychology of the second brain that he uses.
I never heard about that. It was so strange, but was interested. And when I came back home, I always went to read something on the internet. If I found something that was strange, but it sounds to me that could be possible.
You felt something. There was something about it that felt
yes,
it might
was possible. But when he told me that for solve my case I need 25 encounters or sessions, I said it's impossible. I can say that because every case is different. You can treat any case and said before that you need 25
encounters,
tot numbers of cases, also sections.
Such and such a number of
I say, well.
So you found that strange?
I was strange, but I was I felt very bad that I said, well, we can try. It's him. He's a friend of mine. He's a friend of a friend of mine.
Yeah, he's a friend of a friend. So you decided to trust him.
We can trust him, and because instead of another one, even if I went to other persons, and but they want to treat me with medicines.
I see. Yeah.
And well, I took some of that because they calmed me down.
Yes, of course.
But the first section I was, but this is strange. I just want to relax and speak, and without any questions, or just few questions. But it's different way on the method that we are used to see in the television, or
of course,
or the other. Tell you how is this section is going on. It's
completely of course.
Different.
Or the psychiatrists, or you say whatever. Yeah.
Well, you can't believe that, but at the end of the 24th session, I was like before this bad period.
I see.
So
you were like new.
New. It's like before.
Like before. That's a good point.
So I was feeling stronger, and it was just a bad record.
A bad memory. It was like a bad dream.
Yes, a bad dream. Even if when the only thing that remained to me, because of my way, is when I can breathe properly. That's case remind me that period, and maybe they became anxious again. But
I see what you mean, because you've got a slight bit of overweight. If that impedes your breathing sometimes, and when you feel that when you're doing some exertion, that the memory of your panic attacks comes back, and that worries you a bit. Yes, I can understand. But that's the only thing actually that you're suffering from at the moment.
Yes, only when I eat much in the evening, mainly in the evening, because after that I don't have any time to have a walk.
That's true. Yeah. And what did the panic attacks get in the way of? You've described what they felt like, but in fact, what effect did they have on your life? I mean, what did they stop you from doing, for example? I was very worried in sleeping, because many of these panic attacks, I don't know why. I mean, now I don't know why. Yes. Before I didn't know. Came in during the night. And so I didn't sleep properly. And also to go to the work, I used to take the underground, the metro. And when it's crowded, and maybe it stops in between two stations. Made you
I
very
felt
anxious.
a little bit anxious. Not now.
I mean we're talking about before.
And Armando told me that these steps could have worsening during the time if I didn't take a decision to
solve the problem.
Solve it.
Of course, yes, in fact, it's true.
And maybe he said that it was at the first stage. I said, I can imagine when it's at the end of the stage.
Well, the people who do suffer from panic attacks chronically, actually, they often don't even leave the house very often. So, in fact, you did catch it in time, because some people stay at home for years for that very reason.
It seems strange, but
now that you've experienced
this short time, if it was an experience before, the effect was that I can believe that at the end it could influence your life very heavily.
So you were reasonably fortunate because it hadn't been going on for very long. So in fact, it was beginning to interfere with your work already because you were.
Yes, I felt always depressed, no smiling. Also, of course, the relationships not with your wife your parents were very different.
In those circumstances, you mean?
Yeah.
Yeah, because of your anxiety.
Yeah, also because I say what I have here.
Of course. Of course.
It's very also other people. If you don't experience this problem, is quite difficult to understand.
Just how much it can affect you.
Yeah.
And did it interfere? For example, you travel for work, don't you?
Yeah.
Apart from the underground, I mean, you.
No. Abroad, yes.
You travel abroad.
Yeah.
Did it interfere with your traveling abroad?
Well, before I discovered there was a panic attack. I had the same bad experience during the flight because I was relaxing in my seat, and suddenly I opened. It was.
You were resting with your eyes closed.
Yes, but it was a day flight, so not during the night.
No.
A day flight. I feel like anxious. I want to
get down.
To get down.
Bit difficult.
No, I mean, it was the first time because I flew many times. I don't know, in every part of the world.
Of course.
I haven't had any problem before, and I went to the back of the plane and said, "I stay here." And the servant said, "You can stay here." I said, "Please, I have to stay here because otherwise it's a problem for you."
It's a problem. I'll be opening the door and jumping out.
And fortunately, the flight was only 2 hour flight.
Yeah, but as you say, that was just the beginning. It could have got much worse. Not very pleasant.
No.
So how do you feel now? All these problems are in existence.
Well, problems coming always on you any days, and also in this period is very stressful for the job.
Yeah.
And for other problems that they have in private sphere, not in relationships, but
your personal life, shall we say?
Personal life. But I mean, I have some stress. But I feel like before this.
Yeah, exactly. Despite that, you haven't suffered from.
Sometimes I had just 2 weeks ago another kind of
a memory that came up.
Memory of that attack, but I can manage it. I also I had another encounter with Mr. Ingegnieri, and I felt relaxed. It's okay. The only problem I have is to lose weight.
I see. Okay then. Well, thank you very much then.
You're welcome.